and Tamika and Chantel. Am I pronouncing your name right? Chantel or Chantal? Chantel and Tamika and Chantel. Am I pronouncing your name right? Okay.
Let's see. What email did you send it to? My work or my personal? Because I don't see it yet. But it's okay. I don't want to slow things up.
The agenda is in the chat.
Oh, okay. Thank you.
Okay, so I'm going to open with a prayer and we're just going to get started with this. Lord, grant our sisters who are dealing with breast cancer and other illnesses the strength to face each day with courage and hope. Help them to trust in your plan and your peace and your presence in their lives. As in Psalms 28 and 7, we pray you, Father, are their strength and their shield. Let their heart trust in you, and we pray for your help in their fight. Heavenly Father, calm their fears and anxieties. Let your peace wash over them and give them the strength to endure this storm and other storms that they may face. Allow the women in this forum tonight to provide information, important, necessary, valuable information to those who need it. We pray their strength to use this information to the best of their abilities. In Jesus' name, amen. So it is
Amen.
National Breast Cancer Awareness, and we wanted to be able to provide information during this month to women who are dealing with breast cancer already, and especially those who don't know that they may be. We wanted to make sure that we provide, that we empower women regarding this particular disease. And we have an empowering panel of women ready to speak about breast cancer awareness for this Breast Cancer Awareness Month in October 2024. We want to share information, build awareness, and share alternatives if necessary and when necessary for the sake of sharing, because people need it. We need this information, and we are thankful for such a panel. The first person to speak to us this evening is Karen Hall. She's going to open the panel to raise awareness and share statistics when
Thank you.
necessary. You should be able to share your screen.
Okay.
Okay.
Can you see it?
Yes, very well.
Okay. Thank you. Thank you so much for allowing me to come on your platform. It is a privilege and an honor to be here tonight. My name is Karen Hall, and I am the founder of Cancer Support Team. I am a two-time breast cancer survivor, mother, caregiver, advocate, cancer care ministry leader, motivational speaker, and lastly, I am a co-facilitator of a breast cancer survivorship VLC where we train community leaders to support our Black and Brown communities as far as cancer is concerned. So every October, we observe National Breast Cancer Awareness Month, right? Breast cancer is a disease that affects both men and women and is amongst the most common type of breast cancers under skin cancer. According to the CDC, about 1 in 8 women get breast cancer in their life. Additionally, and this is really, really critical for us, Black women die from breast cancer at a much, much higher rate than Caucasian women. So, what are we going to talk about tonight? Breast cancer awareness. What is breast cancer awareness? What we're going to discuss, or what I'm going to discuss, I'm going to look at some statistics as far as African American women as it affects them with breast cancer, but also early detection. And early detection means finding cancer before it spreads, right? And it can help diagnose your treatment earlier, and you have an easier outcome than any others. So there's three top sections um, when we talk about early detection. One, breast self-awareness. Two, well women exam. And three, mammogram. So we're talking about statistics right now. I'm going to lower this thing so that I can see my screen. So as far as Susan G. Komen, I went on her website and we're talking about from the National Cancer Institute, estimates for breast cancer in the US, right, for 2024. It stated that over 310,000 new cases of invasive breast cancer will be diagnosed. About 56,000 new cases of DCIS will be diagnosed. And they are estimating about 42,000 women will die from breast cancer. Now, the difference between the invasive breast cancer and the DCIS, the DCIS is non-invasive, meaning that the cancer itself is retained within the breast area. Invasive means that the cancer has spread beyond the basic breast of the individual. Looking at some differences as far as race and ethnicity. As I mentioned earlier, Black women are more likely to die from breast cancer than any other ethnic group. And that is really, really, really alarming for us. We are 41% more likely to die, even though what they're calling incidence, here incidence is the same thing as new cases or new diagnosis, even though our incident rate is much lower than white women. One of the notes that I want to put here is that we as African American, Black and Brown communities, we need to be more involved with clinical studies. Clinical studies is where the actual treatment plan comes from. If we're not in the room, then the plan that is created does not work for us. And that is so prevalent when we look at the next bullet point where we're talking about Black women have a higher risk of triple negative breast cancer, right? And triple negative breast cancer is characterized by the absence of three common receptors known to fuel most of the breast cancer growth: estrogen, progesterone, and HER2 protein. Now, with the absence of those, it makes it very difficult for the hormonal therapy to work. Okay. And that's why we call triple negative a more aggressive cancer, and it spreads, and oftentimes it reoccurs. And the most alarming part of this is that triple negative breast cancer is being diagnosed in our younger age Black women, which can complicate their treatment options. But also, we're talking about women that's in their childbearing age. The other two, 82% of Black women live at least the 5 years, but the last one is a little more uh, prevalent to me. White, Asian, and Pacific Islander women are more likely to be diagnosed with localized breast cancer, and that's why their survival rate is much higher than ours. Localized means it's not invasive, it has not spread beyond the breast tissue area, and it's easier to treat. So here we go. Early detection. Early detection, it just means what it says. It's finding cancer before it spreads, right? Early detection means when the cancer is located and it's localized, has not invaded anywhere else, you have a 99% survival rate after the 5 year mark. Early detection includes women doing their monthly breast exam, regular clinical exam, and mammograms. So the 3 steps of early detection that I'm covering is 1, breast self-awareness, 2, well woman exam, and 3, mammograms. Breast self-awareness, that's the first step. I just mentioned that, right? So you need to know what's normal for your breasts and what your breasts look like in order for you to even know when there is any type of change or abnormalities that's happening. So it's important that we do our monthly self-examination. So one of the things that we're looking for when we do our self-examinations is breast lump. And the breast is a mass, it's a growth, it's a swelling within the breast tissue. It can be solid, thick, it can be noticeable or not noticeable. The size varies, the shape varies, the feel varies, right? So it can be from a small pea size to a large golf ball size. It can feel round, smooth. It may move or it may just be hard, jagged, and stationary. The breast lumps may be present in one or both of the breasts. Some breast lumps may cause pain or discomfort, but many do not. So please be aware of that. Now, if you find a breast lump, schedule an appointment with your doctor, but don't panic.
Mhm.
In fact, it is stated that 60 to 80% of the breast lumps are non-cancerous. However, please just do not assume that 60 or 80% is non-cancer and you automatically fall within that percentage. Please do not do that to yourself. It's important that you follow up with your doctor because it does not mean that cancer cannot or has not developed in your breast. Now, breast self exam. Some women's breasts are more textured or dense. And I know a lot of people nowadays we're saying, what is dense breast? Dense breast has relatively high amounts of granular tissue and relatively a very, very low amount of fatty breast tissue. Okay. So it makes it very, very risky for women to have mammograms. Okay. So if you have this breast and you are at an increased rate of breast cancer due to some genetic mutation or other factors, your care team may recommend alternating MRIs and mammograms. That way, they will be able to catch any abnormalities as early as they possibly can. So then we're still talking about our breast self-exam. The feel of your breast may change during your monthly menstrual cycle. So please do not schedule to do your self-examination during that time because we realize that our breasts are tender at that time. Perform your monthly breath to look for changes. any changes in the breast. The breast tissue extends throughout the chest, up on your chest wall, under your arm, and up to your collarbone. And I know most people are like, well, that's not my breast. Yes, it is. As mentioned earlier, I'm a two-time breast cancer survivor. And both times my diagnosis didn't have any pain or anything else. The first time it was centralized in the breast itself. The second time it ended up on my chest wall on the same side as the side that I had my mastectomy. So, what are some signs? Naturally, if you're doing your regular mammograms, you're going to recognize when things come up. A new lump, a mass, there's swelling, there's changes in the size and shapes of the breast. Maybe you have swollen lymph nodes that's under your arm or up here by your collarbone, right? Your breast skin changes. It may get red, flaky, or thickening. There may be some discharge from your nipple, right? Those are important. And the last things on here that I have is pain in the area of the breast. I had no pain. So please don't sit back and wait until you feel something before you do something. Okay? That's really not a good practice to keep. So if you have any of these signs, be sure you see the doctor right away. Our second task is well woman exam, and that's simply a clinical exam, right? So when you do your yearly routine pap smear or a routine pelvic exam, make it a routine also for your physician to do a breast exam, right? Check for anything that is different in your breast. Now, when the doctor does your clinical breast exam, they do two different things, a visual and a physical. With the visual, they look at the appearance of your breast. They may ask you to raise your arms and they'll look and see if there's any symmetry, that your breasts are the same. Seeing if there's any difference, if it's a lump here and or this one is larger than the other one. They may have you put your arms down or put your arms on your hip. They are looking for a visual change in your breast. The skin covering the breast, they examine it to see if there's any dimples or a rash or anything like that. And then the nipple, sometimes, not all the time, they may squeeze your nipple lightly to see if there's any fluid discharge. That's a visual check. Let's look at the physical check. They take the palm of their hand and then they check your entire breast. They'll go up under your arm. And remember, ladies, they'll come to your collarbone as well and check for any lumps or any changes, right? If there are changes, the doctor will notate the size, shape, and texture, and then will send you for further diagnostic testing, such as a mammogram or ultrasound, or a biopsy. The third step of the three to increase your chances of detecting breast cancer early is the actual mammogram. And the mammogram is an x-ray of the breast, as simple as that, right? It's safe to detect any cancerous tumors or any changes to your breast. Know the difference. There's two types of mammograms. We have a screening and a diagnostic. With the screening, that's what we mostly get when we go for our annual mammogram, right? That's the routine check. A diagnostic mammogram is when they have to do a little more in-depth investigation, and maybe you have discovered a lump or your doctor have discovered something that an additional look is very, very necessary. So with the mammograms, the technology has evolved now. A lot of times we receive a 3D mammogram versus a 2D. For women, when I mentioned earlier about some of the things that you can talk to your physician when you go for your your yearly exam, one of the things is you can ask them, do I have dense breast? You know, if I have dense breast, is it recommended that I get the 3D mammogram, or do I have to go every 6 months versus every year? You know, or what is the plan based on me? And we're talking about your individual plan. So the overall, with American Cancer Society, the three that I just went over are the three. Step one, breast self-examinations. You should start that every month at age 20. Two, the clinical exam starts at age 40. And then three, your mammogram, sometimes every year, other times it's every 2 years. It really kind of depends on your individual recommendation. So, in closing, be your own advocate, know your family history, make sure you do your testing, your screening, self exams, yearly clinical exams, and your mammograms. Develop a healthy diet, exercise. Naturally, we need to not smoke, right? Seek support and resources if necessary. And for this presentation, here's just a list of the different resources that I went to develop the presentation for you tonight. And I want to thank you and give you a little bit about Cancer Support Team. Cancer Support Team mission is to empower, inspire, encourage, and uplift cancer patient survivors. We are committed to tackling the health disparities in under-resourced communities across Chicago and its surrounding suburbs. We provide complimentary aftercare services, which includes free wigs, care packages, individual support groups, quarterly caregiver groups, and educational workshops, resource, and definitely emotional support. And lastly, I just want to thank you, the panel, for giving me the opportunity to share with you the significance and importance of breast cancer.
Thank you very much, Karen
Thank you.
Hall. Next up, we have Chantel Wyndham, and if I pronounced your name wrong, please correct me. She will discuss the necessity of screening and early detection. Thank you.
Thank you so much. Going back to just how we started the session, I am even more grateful just listening to Ms. Hall and her organization and realizing how close they are to me. That's just an additional resource for me. So I echo everything that she said in terms of the early screening, and I'm going to share my story as to how it affected me. So through God's grace, I became a mother later in life after several years of trying, and life got busy. So I started having my mammograms at 40 and then had my son a little bit later, my very late 30s. And the first mammogram came back suspicious, but I had no family history of breast cancer, so it never even crossed my mind. My results were sent from my regular OBGYN to the Mayo Clinic. My radar went up a bit because I know that's a very well sought out medical facility, usually when it's serious things. I received my results back from the Mayo Clinic, and it just stated suspicious. Look at it again at your next mammogram. Also during this time, my OBGYN retired, and I did not find a new one immediately. So with dealing with life, I'm an educator. So I was working in the classroom, having a newborn child. I did not seek a doctor immediately because the last information I had received from the medical team was, we'll look at it again on your next exam and basically go about your business, which is what I did. I went about my business. Well, after staying home with my newborn for 2 years, and I breastfed him. I was always taught, breast milk is best. So I breastfed him a solid 2 years. About 2 weeks after I finished breastfeeding and I weaned him, my, for once, voluptuous breasts that I had never had before, but now I was a full B cup, went down. And when my breast went down, I noticed a little lump. But when I started mentioning it, I'm going to start with friends and family who you usually go to first. Most people told me, baby, ain't nothing to worry about. It's probably a clogged milk duct. You've been breastfeeding. That's just some milk that needs to move out. Just so happens, it was time for another exam. I went in for my mammogram, and at the very first appointment, the technician that did my mammogram, when I came out and I was, ready to just again keep moving along on my merry way, said, the doctor needs to see you for a follow-up appointment. Okay. The next appointment, I had an ultrasound of my breast and my underarm, which I thought was odd, because thank you, Ms. Hall, for mentioning how breast cancer can spread and be different areas. Well, it had metastasized into my lymph nodes, which is what they saw on the initial mammogram. Things progressed very quickly. This was in October of 2017 while I was at home with a newborn. I had, again, been home for 2 years with my son. I went back into the school system in August. And never in my life have I taken long-term disability because it was an extra $10 fee and I thought I would never need it. I wasn't that old. I was only 40 something. But for some reason,
Wow.
God put it on my heart to click every button when I went back to work and I was doing my medical, get long-term, get every type of thing that they can give. I went back in August, and in November, I was diagnosed with invasive ductal sarcoma, stage 2, in the breast with the lump, stage 2, in the other breast without a lump. It was more aggressive in my breast without a lump. It had metastasized to my lymph nodes. So as soon as I went back into the classroom, I then had to go on short-term disability. I went on long-term disability. This cancer was coming for me so aggressively, I immediately had to start chemotherapy. I did several rounds of chemotherapy. Lost, of course, every stitch of hair on my body. I think that's one thing they don't tell you, that you don't just lose it on your head. You wake up and you wipe off your eyebrows, your eyelashes, your underarms, everywhere. It goes for the good cells as well as the bad cells. I had a double mastectomy. I did 30 rounds of radiation. I did another almost year of hormone therapy. Then I had oral chemotherapy, which was worse than the infusion. It was 8 pills a day. And I thought, oh, I'm okay now. No more getting the IV. Got my port out. But the oral chemo is what almost took me out. I went from 160 pounds to about 99 pounds. Now, that sounds like, of course, all the bad. While going through that, I was still blessed. My mother was still living, and my mother does not like hospitals. She doesn't like needles. She doesn't like anything. I've been here in Chicago about 25 years. My family is in Louisiana, but my immediate family is in Des Moines, Iowa. The night I got the call from the doctor that said, we've done your biopsy and it is indeed cancer, and we're going to start this immediately, my family started a rotation, and every chemo, somebody was with me. Somebody was on the highway, sitting with me, praying with me, getting me through it. My church family was sending me food. My neighbors. I'm the oldest, so being the oldest, we can't take things sitting down. It's what are we going to do? But during this time, I'll never forget talking to a cousin who is she's that cousin that no matter what you're talking about or going through, she's going to bring out a scripture or she's going to bring you back to faith. And I was at a point where I felt like I was getting down mainly because of my appearance. I just didn't feel like a woman. I didn't feel like myself, and I was weak. It takes everything out of you. And I remember asking her, I remember saying, I know you're not supposed to question God, but I wonder why me. I've gone through the family, and nobody on my mother or my father's side seems to have ever had breast cancer. I've been healthy. I've been an athlete. I've been doing what I need to do. I've never drank. I've never smoked. And she told me, you know what? Don't ask that. Don't ask why me. Ask why not me. She said, why not? What makes you so special that God didn't choose you to be a testimony later on?
Wow.
I didn't understand it at the time. During that time, through all that treatment, my mother sat with me. My mother came like every other month, helped me with the appointments. She would rub my head when my head hurt. She was there from like when I was a child, holding my head up. And she got me through it. I finished my treatment, and in 2021, my mother told me, you're going to be okay. You're going to be okay. You have a child to raise, you have siblings, and you have a story to tell. And I said, okay, but we're going to do this together. My mother told me, unfortunately not. I'm tired. I'm tired. But you have a lot to do. So I wrote a book titled, I Had Cancer, Cancer Never Had Me. And I told my story on my 50th birthday, and my mother passed away in 2021. So she never saw my book. And it was never for fame, fortune, monetary. It was to get my story out, because my story is about all of those that supported me, my village. My village, if you know me, I'm a big Chicago Bears fan. Chicago Bears was my village. I've done a lot of things with Bears Cares Foundation. My school, I'm a science teacher, was my village. When my students sat in front of me and were crying, oh, Miss Wyndham, you're going to die. Because all they knew is about grandma had cancer or a neighbor had cancer. I said, you know what? Let's talk about the science of it. Here's what's going to happen to me. I'm going to lose my hair because it's going to take the good cells. It's going to take the bad cells. I'm going to get these infusions that are going to do all types of things through my body. But I kept telling them, but I will be back. You have to have faith that I will be back. At every appointment, I didn't care if it was a new nurse, it was a new doctor. And most times when you go to treatment, you have somebody different each time, other than your main doctors. Each time Before they pulled out that needle to give me my chemo, I would say, do you pray? Do you believe? If they didn't want to answer me, I would have to move on because I was very intentional with that. I told my surgeon and I told my oncologist, I trust you, but I know that doctors practice medicine. They don't have all the answers. They practice medicine. They are practicing it. And I had to have faith that the main doctor, my God, would see me through. Now, how do I know that? It's because at the same time I was diagnosed, I have 3 friends from my hometown, all diagnosed around the same time. We grew up blocks from each other. So we started talking. Is it the factory that was in the neighborhood? All of our mothers are from the 70s. Is it some of the mushrooms they were doing during that time period? What is it that connects us? And thinking about those statistics that Ms. Hall presented, of those 3, 1 is gone. So we all don't make it to the other side, which is why I am so thankful for my testimony. She had the same diagnosis as me, the same treatment as me. We celebrated at what we thought was the end together. Hers came back during COVID, which she thought was the flu. It had got to her lungs. It came back from stage 2 to stage 4. So I watched my friend who I graduated with, same age, not be here to give her testimony. At the same time, I lost a cousin who was much older, but it also gave me the reason to do more investigation. A lot of times in Black families, we don't talk about a lot of different illnesses. We don't talk about mental illness. We definitely, at least in my family, wouldn't talk about breast cancer, because that means you had to go ask auntie, hey, why does your bra look different? Or do you know? We didn't talk about that. But when I brought the conversation up to my cousins, to my aunties, to my great aunts, they were more receptive than I ever thought. And then it started coming out. Well, do you remember auntie such and such? She died at a young age and she had a mastectomy when nobody was talking about it. The idea of a woman, especially a Black woman, sharing that she does not have her breasts, definitely taboo. But when I did that, I found a second or third cousin that was diagnosed at 20. Went 30 years and it came back. She had a recurrence last year at 50. And so more started coming out. That has definitely helped me. Pulling again from what Ms. Hall said, that early screening. Did I totally advocate for myself? No, because I did not think it was possible because of my lifestyle, that I was eating well, that I was exercising, and because I listened to the myth that it could have been a clogged milk duct. I also did not have a medical team at that time that was pushing me, that was looking, oh, wait, you've missed a year or 2 of mammograms. I need you to get in here. So I take accountability for that. But now I feel I have the purpose to make sure other women know the importance of that early screening. You can be diagnosed at stage 0 and stage 1 and still have to go through different treatments. Every woman's treatment plan varies, but I truly feel that living with faith over fear is what pushed me through, because that was definitely the scariest time in my life. I love that we do this in October. I would like to spread it out. Everybody knows it's not just in October. We need to have those mammograms every time you are due. And those dense breasts, if I hear one more friend say, well, they're going to look again because I have dense breasts, women do not understand what that means and how you have to, again, continue advocating. I had 12 lymph nodes taken out of my left side, 5 out of my right side, because it had spread again to my lymph nodes, which means I don't give blood. I can only do blood pressure checks on my right side. And I definitely have to live through faith now because I'll never have another mammogram. My words from my team are, if you start to lose a lot of weight quickly, or you start to feel ill, or you get another lump. Now that's some scary stuff. I won't be going once a year to have a mammogram because there is no breast tissue. So again, I have to live through faith over fear, knowing those statistics and just wanting to be a testimony for somebody else. So I will end there. Thank you so much.
Thank you. That was wonderful information. Really wonderful. Medina Nance is taking the speaker's spot next, and she's going to talk to us about alternatives to mammograms. She's not going to be on camera, but I will show an image of her as she's speaking. Sister Medina? Sister Medina, can you unmute yourself? Yes, she is.
Yes, good evening. And thank you so much, yes, for having this. I just want to thank God and thank you. It's been powerful information and powerful
Yes.
testimonial.
Yes.
Well, I did want to share what you asked me to speak on, and I hope and pray that it helps some, because at this point we need all the help that we can get, especially living in America.
Yes.
But I wanted to say that it was in the early 90s, and I wish I could remember the doctor's name. Unfortunately, I can't, but she was a young Black female surgeon, physician and surgeon, and this is in the early 90s. And she asked how many women in there had mammograms, and most of the hands went up, but for the ones who didn't, she said to us that a lot of women have delicate breast tissue. And if indeed there is a lump, a cyst, a tumor, or what have you, that for some women, the radiation and the trauma of the mammogram, where there is a cyst, a tumor, a lump, could further irritate and inflame that area. So, everyone was looking confused, like, that's all we've ever known about is a mammogram. So, what do we do if we don't? Because back then they were telling us to start getting mammograms around age 40. We weren't hearing 22 or in your 20s. So she said there is a sonogram, which is visual imagery of a ultrasound, and there is thermograms or thermography. And neither one of those, a sonogram or a thermogram, have radiation. And she said, generally, if doctors do detect that there is an issue, they're going to do an ultrasound anyway. So if you go to a hospital and they don't have or don't do sonograms or thermograms, then you can just ask for an ultrasound, because none of those will add any radiation. And I noticed back then, I wasn't hearing the FDA say that the thermogram is not as effective as the mammogram, but you do see that now. They put in writing that it's not effective. So I say to people, everybody's body is different. We were going through workshops also back then and learning about what the radiation and the side effects of the CT scans and x-rays and mammograms could do to the body. And because they're so prevalent and people need these types of tests for a myriad of things, I remember someone saying, well, get a cotton ball and put an EO, an essential oil, a little essential oil on that cotton ball, and put it in the area where you're getting tested. If it's a mammogram and there's no way around it, or a CT scan or x-ray, and just hold it in place with a Band-Aid. And we were thinking, well, okay, it certainly couldn't do any harm. And if it can help, that's a small, non-invasive thing to do, because we always think of in integrative healing and integrative health of first do no harm. So I found that information to be extremely helpful, because when that meeting was over that we were in with the young Black female surgeon, a lot of people were, telling about how they got their mammograms. And one lady, she said, well, my gosh, it felt like they took, and I'm just going to quote her, these are her words, not mine, it felt like they smashed my titty in a refrigerator and radiated it at the same time. And we were like, yikes, because, we were younger. I remember I was in my 30s. And it was around the time I was diagnosed with lupus and chronic fatigue. And I will say this, and it really resonated with me with Karen's testimonial, is a lot of times we'll say, well, why is this happening? I eat well, I exercise, I do this, and why not me is a good thing to think of, especially the way she framed it. Why not you to be a testimonial to God? Because sometimes these things can be the best testimonial and also send you down a path you never thought you'd go down. I never imagined that I would be helping people with their health and working with other people. We're going to have some dynamic speakers on, get into that, so I won't go there. But it's just been a phenomenal journey. And I get a lot of testimonials, shared testimonials, and I just thank God for you all having this piece. And I hope we do more, because when people hear the C word, they freeze. And I hope you do something else on the D word, because when people hear the D word for dementia, they freeze. That's something else. And there is plenty that we can do to prevent these things. Early detection is one, but there is so much that can be done. And when I look at the things that run in my family, I am doing my best now that I'm officially a senior to prevent them. It doesn't mean I necessarily will, but as my mentor used to say all the time, Beverly Nicholson, Dr. Beverly Nicholson, when you learn better, you're obligated to do better. And I would always think when she said that, yes, faith without works is dead. So I just want to say that I hope that we have another panel and talk about the D word, because I'm always passing information on what we can do for prevention of that, because it's becoming prevalent. And I just want to thank you for having me, and thank all of you for all the powerful information.
Thank you, Sister Medina. We appreciate you. Sister Marguerite is next, and she's going to talk to us about risk factors in treatments.
Thank you, everybody. And wow, I have a hard, coming behind the young ladies who spoke so far. It's like kind of hard to come behind all of this because you guys gave such great information. And I really appreciate everybody sharing their story and seeing how you guys are really getting this information out here is really exciting. Now, just to introduce myself, I am a wellness coach, a herbalist. I actually trained under Sister Medina Nance, and I'm also a licensed massage therapist. So I can't say so much about what treatments. There are risk factors, of course, we know, and everything. Like she was saying, you're gonna fight the good and the bad cancer cells, the good cells and the cancer cells when getting certain treatment. But when Sister Michelle had invited me to this panel, the one story I did come to mind, and I wanted to share that, and then I wanted to share a little bit about the lymphatic system because I do lymphatic treatment. Is that I went to a natural health fair many years ago in the early 2000s, and we were all herbalists there. We had this device called the Zytoscan, where it actually reads your body through the touch of the scan, like picks it up at the cellular level. So we were real excited about that, but it was a guest speaker there, and he had, which is a little different from what we're talking tonight, he had colon cancer. But the story that he told, I think everybody could keep in mind, is that no matter what type of treatment that you do choose, and I know there'll be side effects, he decided not to get radiation. So he said what he did was, and he looked great. He was an older gentleman, but you would never guess his age. He was a very handsome, sharp guy, debonair. And he went through the whole cancer. They removed the tumor in his colon, but he chose not to get radiation. So everybody's like, well, what did you do? So he was saying he went plant-based. He said his wife filled up the refrigerator every month. He ate very, raw, mostly raw, and was eating a lot of salads and just a real healthy diet. He was working with Dr. Hugh Jenkins, so he had him on a herbal regime, and he chose not to do radiation. And so when he still went in every 6 months and got his exam from the doctors and everything. And when he walked in the door, they said, well, you haven't had radiation, have you? He said, no, how can you tell? Because they said, well, you look too good because, the radiation does break the person down. So the people in the audience, they raised their hand. They were like, well, this was his family. Of course, your family will bust you out. His family, like, well, didn't you used to eat pork and pork chops and chitlins and all hog maw? He said, yeah, one time in my life I did eat like that, but now I'm eating more plant-based. He was on his regime and he did very well with that one treatment. So that's just a story I wanted to share because I think no matter what treatment we may have to choose it at certain points in our life, if we did have to deal with cancer or whatever else, the lifestyle is so important. We all should be on a lifestyle right now, preventative health lifestyle, and monitor, like we were saying, self-checkups. And like as a massage therapist, I know there's a lot of young women, they'll take their cell phones, that's the worst thing you can do is stick your cell phone down right on the breast. I heard a lady one time said they've been seeing diagnosis of breast cancer the size and shape of a battery of a phone because you're just putting that radiation right there on your breast. And when I do massages, sometimes some of the young girls, they don't even want to put their phone down. They put the phone right up under their breast while I'm giving a massage. And I just can't, I said, no, don't put the phone. Please move your phone away from your breast. So it's just little bitty things that we can do. Because I know even for the prostate cancer, they were saying men were sticking their, phones right by their prostate and getting diagnosed as prostate cancer. Because you could be exposing yourself to things without realizing it. So we got to be conscious of our food that we eat, what we're exposing ourselves to. Like I know the one young lady made a good point that she knew a lot of people herself and they were all living in a certain neighborhood or area and it had factories. You're exposed to toxins, pollutants, everything. We just don't even know really what we're all exposed to. So all we could do is just try to do whatever we can to be acknowledgeable, like we're doing tonight, and learning, alternatives. Just like Medina gave a great example. There's not just the mammogram, there are other alternatives even in that area. So I just wanted to point that out. And also, you guys, I am on TikTok because right now, I'm really learning a lot about the blood type diet. So if you guys check me out on Mom's Herbs, you can learn more about eating for your blood type. And also, I did do a demo on the self lymphatic because we have lymph nodes behind our ears. There's a lot of lymph nodes under the arms, even in the groin area. So you can every day do a self lymphatic. And I found it interesting. She mentioned over in the clavicle area because that's part of the lymphatic treatment. You can go over your clavicle about 8 times. Every day you can do this. Go under the arm 8 times, even behind the ears and around your face 8 times. And then you could tap. It would take you less than 10 minutes to do that treatment. And I do a demo on my TikTok. I'll post my TikTok on the chat. So that's another thing we can do, self-lymphatic treatments. Because I know sometimes when you get them lymph nodes removed, the body is smart enough to circulate where your lymph nodes are working. But some people do end up with lymphedema later on in years because they had so many lymph nodes removed. My sister's example, she's a breast cancer survivor twice. She had breast cancer and thyroid cancer. But now she's almost 80 though, and she's dealing with lymphedema. And even with that, she's getting treatments where she's getting massage. It's a treatment that she can put on her body, and it will massage her body every day to help activate the lymphatic system. So there's so many alternatives out here. I think our most important thing is to keep doing what we're doing right now, and that's spreading the knowledge. And I appreciate everybody's input. And I'm going to just share my TikTok if you guys want to learn that self-lymphatic treatment to do every day. Thank you so much for inviting me.
I'll make sure that I post that on the website, on Preacher Ed Ministries website. And for everybody, if you have written information or the PowerPoint that you shared, Ms. Hall, if you all share that with me in an email, I'll put my email address in the chat for those who don't have it. I will make sure that your written information is posted on the chat on the website. Also, thank you, Sister Marguerite. Thank you so much for your exercise. And make sure you put that link in the chat so I can put it on the website. I think it's important.
I will. Okay.
Next, we have Patricia McBroom, who's going to explain to us what the lymphatic system is and what the lymph nodes are.
Well, hello there, ladies. I am this. First of all, I want to say this is a awesome Zoom because, of course, it's Breast Cancer Awareness Month, and we're getting a wealth of knowledge and information about alternatives and for those who can do mammograms, those who can't. So there's a lot of options out there that we have now that we probably didn't have years ago. So that's awesome to have. But I'm going to get into this lymphatic system and my notes. And before I start with that, I want to kind of give everybody an idea because a lot what I think Sister Marguerite and somebody else mentioned where some of the lymph nodes can be in the body. And so one thing that I remember as a kid, and y'all probably remember this too, whenever you would go for your checkup at the clinic, the doctor would always check up under here and check, and they were checking for your lymph nodes to see if they are swollen. And so whenever you get swollen lymph nodes, I don't care if it's here in the neck area, groin area, up under the arm, that's a signal to let you know that there's an infection going on. Something is going on. So I just wanted to point that out, because a lot of times people will go to the doctor and they'll do this little quick thing and they don't know what they're doing. They're checking your lymph nodes to see if they're swollen or if they're tender, to alert them to let them know if there is an infection. But I'm gonna get into my notes. And you all could see the graph of the lymphatic system there. But the lymphatic system, what it is that it drains fluid from the tissues throughout the body. Okay. And what it does is it sends it to the bloodstream, and it also plays an important part concerning the immune system. So your lymphatic system and your immune system, they work together. They're friends. They cool with each other. And so what the lymphatic system does is it flushes the fluid through the body, and it also removes particles through the fluid. Okay, so whether if it's just lipids or what else? Lipids or damaged cells, they're moving through the lymphatic system. Okay. And so what the lymphatic system also does is it also works with your white blood cells. And what that does is the white blood cells help the body to fight off an infection. So when there's something going on, that lymphatic system is going to alert the immune system, which is in turn going to alert those white blood cells, hey, we got an infection, we got some work to do. So that's how the lymphatic system and the immune system work together. Okay. And some of the things that the lymphatic system does is it absorbs lipids within the small intestines. So it absorbs lipids within the small intestines, and lipids are fat cells, and it also removes the lymphatic fluid also removes damaged and old cells through the body. So if the cells, because our cells are constantly replenishing, so they'll die off and then we'll have some new ones, or if there's some damaged ones, they're constantly moving through the body. So the lymphatic system helps with that. And it also produces and stores lymphocytes in the thymus. And what a lymphocyte is, it says a lymphocyte is the white blood cells that are a part of the immune system, and they help to protect the body from infection and disease. So that's what a lymphocyte is. And all of this is included within the lymphatic system. And I also want to mention that Sister Marguerite, she mentioned her being, she's a massage therapist. I know Sister Marguerite. Hey, Sister Marguerite. But you can go to a massage therapist and you can get you can have work done on the lymphatic system to get them fluids moving through the body so that it's not stagnant. Because once it's stagnant, then that's where you can start having issues. That's where cancer can start, or infection or illnesses, if it's not moved around, if you're not massaging the lymphatic system. And it also mentions that you can, to get the lymphatic fluid moving, you can do exercises as far as walking, yoga, just any type of movement can help to get the lymphatic system to get it moving and circulating through the body. Now, I don't know if you all are familiar with this, but I've seen a lot of people doing they'll do the little, they'll bounce up and down on the small trampolines. Well, even that will get that lymphatic fluid moving through the body,
Awesome.
so that it's not stagnant. Okay.
Awesome.
And it's, hello? Did somebody say something?
I just said awesome. I
Oh,
have one of those next to my couch. I'm
use it.
sorry.
It's really awesome. And now they even have a little machine that you stand on and it vibrates the body. It actually shakes the body, which is actually getting those lymphatic. It's working the lymphatic system to get the lymphatic fluid moving through the body. The components of the lymphatic system, you have the lymph, which is the fluid that travels to the lymphatic vessels. Okay, the lymphatic vessels, they're thin tubes that carry the lymphatic fluid. So everything is working together within the lymphatic system. And as you can see on the chart, the little green areas on the chart, those are the lymphatic vessels. And the lymph nodes, which I mentioned earlier, those are throughout the body. You have them in the neck area, the chest area, the groin area. Sister Marguerite, like she mentioned, behind the ears. So if you notice that and I also forgot, and up under the arm. So if you notice these lumps, these little nodules, I call them little nodules, in different areas of the body, and if it's sore or tender, I always recommend clients to go to see their doctor to find out what's going on, and they can do tests to find out if it's an infection, and if so, what type of infection. It can be viral, bacterial, or fungal. And so they can check and see why your lymph nodes are swelling and tender. I'm trying to see, did I cover? Because I wanted to keep it I didn't want to overwhelm anybody, because the lymphatic system is, it has a lot going on. It has a lot going on. And one of the sisters mentioned about, I think it was Sister Marguerite that mentioned about her, someone she knows that has the lymphedema. I have an aunt who is a breast cancer survivor, and she has that issue with her arm. Like, she can't get her blood pressure taken on that arm that's swollen, because they removed some of the lymph nodes along with her breast, because she had breast cancer. And so when these lymph nodes are being removed, because we need our lymph nodes, they're there for a reason. And so when they're being removed, it's kind of taking away some of your, I always call them your body alerting yourself to tell you, hey, something's going on. You have an infection. So when they're removed, it can cause other problems. The body's not able to work with the immune system. I mean, the lymphatic system is not able to work with the immune system when the lymph nodes are removed. So I just wanted to put that out there. Let me see. Oh, and concerning cancer, when there's cancer and there's issue with the lymph nodes, and the cancer reaches the lymph nodes, well, like I mentioned earlier, we also have lymphatic vessels. So if those cancer cells get within the lymphatic vessels, those cancer cells can easily spread throughout the body, which can cause, you may have cancer. Let's say you have cancer in the breast. Well, if it gets inside those lymphatic vessels, then that cancer is going to spread. And that's one of the ways how cancer spreads, if it hits that lymphatic system and gets in there and start moving through there, because like I said earlier, it's aligned with the bloodstream, and it's aligned with the immune system. And so that's one of the things that makes the lymphatic system so important, because we want to make sure that it's constantly that you're constantly moving, that nothing's stagnated, because when we're not moving, everything else slows down. your blood slows down, your energy slows down. So that's why movement is always so important, because it gets stuff going, it gets stuff circulating. Because if you're not moving, the blood's not circulating properly through the body, which can cause other health issues, can cause heart issues, can cause high blood pressure. So just being able to have the lymphatic system working and moving and flowing like it's supposed to, it helps with the preventative side of keeping cancer at bay, or keeping other infections at bay. Let's see what else I have here in my notes. Oh, if there's an infection, whether it's cancer or whether it's injury, to the lymph nodes in that area, like I mentioned before, they're going to enlarge. And what happens is that it makes it harder, a little bit harder, for the bad cells to be able to be attacked by the immune system. So whether it's injury, or whether it's cancer, or whether it's just the lymphatic system being stagnated, these are problems. Because like I said earlier, I'm going back to the lymphatic system and the immune system working together. And I also want to say this, God is awesome. And God is awesome because this body that he gave us, everything in it works together so that to keep us healthy. And so with all the environmental stuff that we have to do, whether, the bad air, the bad food, the bad water, if we can focus more on preventative, then it'll help the body to be able to heal itself faster, because our bodies were made to heal itself. But if we're not taking preventative measures, or whether it's we change the way that we eat, we drink more water, we eat more fruits and vegetables, and these are just preventative things. But when we don't do that, then the body is not able to do what it needs to do to help to assist and heal itself. But that's the lymphatic system. And if we could just use preventative measures to make sure that we're moving, that we keep that lymphatic fluid flowing through and not stagnated, then it will lower our chances of getting cancer, getting infections, or even having issues with breast cancer. And so, yep, that's the lymphatic system.
Thank you, Patricia. Thank you so much. I appreciate that. Everybody's given different information, and everybody's getting providing necessary information that we all need, and hopefully other sisters, other women will be able to watch this Zoom call and access the information that they need in order to work with their doctor. Tamika, you're the last one up. You're an important one up. Thank you for your participation.
Absolutely. Hello, everybody. I'm so grateful for all the information that has been shared. Before I even, got a chance to talk, I was hearing a lot of really great things. I'm fortunate that I haven't had any experiences with breast cancer myself. Praise the Most High. And I am aware of the alternative that Sister Medina shared earlier, because the past couple of times that I have had my mammogram, they've done the sonogram or the ultrasound mammogram. So yeah, that's definitely a lot less invasive than doing the traditional. But I'm here because when Imam Michelle spoke to me about doing the breast cancer awareness, the first thing that I said to her was, the only thing I could think of was ways that we can detox our body and get rid of some of the chemicals that are in it. Although I haven't had personal experiences with breast cancer, a family member, mom's passed away from breast cancer, and she was the one who enlightened me to the fact that a lot of the deodorants and antiperspirants in America have aluminum in them. And so I immediately tried to switch from using the regular quote unquote deodorants to using the alternative natural ones like Navient, which, is like about $12. So I said all that to say this. In going natural, one of the things that I discovered is when you start perspiring, you begin to smell your pheromones a little bit more. So one thing that can help us is detoxing our lymph nodes under our underarms. And there are two ways that I have found. TikTok University is a great tool, as Sister Marguerite is sharing how she uses it to get the information out. I can tell you that I found a couple of different detox videos out there. One uses equal parts bentonite clay and apple cider vinegar. One that I've used quite frequently here on the continent where it gets very hot is straight lemon juice squeezed from a lemon and baking soda, that I would make a paste out of, because at first I couldn't find natural deodorant here. So I would just use the lemon juice and baking soda, put it under your arms, and then wash it off. And when I tell you it works great with detoxing under your arms, I could go 2 or 3 days where there was no odor, even though I would go walking, do exercises or whatever. So that helps. And then after that, I have learned how to make natural deodorant. And so to my sisters, again, TikTok University, I have shared some of the links with Sister Michelle already of some of the videos that I have found helpful. You will find that it's a lot more economical to make your own natural deodorant using things like coconut oil, shea butter, tea tree oil, and baking soda. And it's pennies on the dollar compared to trying to go out and possibly buy more expensive deodorants. And those things will help, as far as my understanding, with limiting exposure to harmful chemicals under your lymph nodes, under your underarm. I hope that helps, ladies.
Thank you so much. All right, everybody. We're done. If anybody has any last words, everybody can take a minute, only a minute, if you need last words, so we can wrap this up. And again, if you have written information, that anything that is printed that you can scan and send to me in my email, please send to me in my email, and we will make sure that that information is posted on the website. We hope we gave you a variety from several different aspects, because we need to be able to make informed choices, and that's what we tried to do, make sure that everybody that we presented a variety of information to help everyone make an informed choice. So 1 minute, if anybody wants 1 minute, just unmute yourself.
Well, I have a lot to add, but I'm just going to stop and say thank you so very much. This was really awesome, awesome, awesome. I learned a lot, and hopefully what I brought to the table to share is very instrumental.
Absolutely.
I
It was.
listening to all of the other presentations. It's an awesome platform. So thank you very much for the invite.
Fantastic. And also, if you all have a website, a business card, send me that to my email too, and I'll make sure that people have your information if they want to contact you. We just want a variety. So send me that in my email, and I'll post whatever you send. Your book, business information, website, business cards, any written information about breast cancer and breast cancer awareness. We will post all of that but I need you to send it to me by 9 a.m. in the morning, please, so we can post it. Thank you. Anybody
Thank you.
else have one last word?
I was just gonna say I will share my website with you because to let anybody who's local, if you want to come get a lymphatic massage, she'll have my website posted because it does, like Patricia greatly explained, we do need to flush out our lymphatic system. We all have compromised lymphatic system just from pollution and the atmosphere. So if you guys ever want to just come get it, and people love it too. It's relaxing, it helps swelling. And it's funny how people afterwards, sometimes people feel like they're coming down with a cold or whatever, but that goes to show you how the body works because your body instantly is starting to work on getting rid of toxins. So people kind of feel it. So
Okay.
yeah, just wanted to
Okay.
share that.
Thank you. Anybody else?
And
Yeah, if I
yes,
could just
I just
add,
like to
I'm sorry.
go ahead.
No, I was just gonna say, they always say it starts with a village. I think it continues with a village because I feel like just with this call today, I've gained some new aunties,
Yeah.
with all these bits of information that always want to work on the whole child. So I just appreciate it. I'm grateful and looking forward to not just ending this call, but connecting on the next
Yeah.
level.
Yeah, and share your information in this chat, your text message, email, so you can talk with each other also. Okay. Sister Medina, I think you had something to end with.
Yeah, I just want to say quickly that because we are bombarded with so many toxins, I just want to throw in there, everybody get a dry skin brush. Dry
Okay.
skin brush your body. Focus on those areas under the arms, around the breast gently. And if you've never done a system cleanse that entails cleaning your blood, your liver, your colon, your cells, your tissues, do that. Do it for 90 days and do 30 days seasonally because it's good prevention as well as treatment and maintenance. I just wanted to throw that in.
Okay. Patricia, did you have any last words?
I just wanted to say that this was a awesome Zoom live. A lot of information, a lot of I learned some other stuff, but
Yeah.
but this was really good. And this is, this is a topic especially for African American women, like the sister mentioned earlier, when clinical trials and tests and stuff are done, it's not those tests and stuff aren't geared toward us, or I want to say for us, because I had mentioned one time to a friend of mine, and she kind of took it the wrong way because she was talking about blood work and stuff like that. And I was like, well, for us, for Black people, like she was telling me, her doctor said her blood pressure being 150 over, I forgot what the bottom number was, told her that it wasn't that high. And I'm like, that's not, I said, for us, for Black folk, that's a whole nother different story. When other people have a cold, we got the flu. You know what I'm saying? So for us, we have to be a little bit more proactive because a lot of the stuff, the tests, the blood work, it's not really geared toward us. But we take the test and they're able to look at different blood work and say, oh, this is what's going on. But prevention, that old saying, prevention is better than cure.
Yes, absolutely. Okay, well, that's it, guys. Thank you so much for your time. It was amazing. It is 8 o'clock. We want to get everybody off of the Zoom, and we pray, Lord Father, in Jesus' name, please allow this information to reach the sisters, the women, and men. There are men who have breast cancer these days, to reach the person, the people that it needs to reach. In Jesus' name, thank you, everybody, for your wonderful information and for your valuable time. Have a wonderful night.
Good night.
Good night,
Good
everyone.
night. Good night.
Good night.
Information Information is in the chat. The recording is stopped. The live is stopped. If you want to take a few minutes to gather that information out of the chat, please do so. Not,
They're
I'll
all
talk to
gone.
you all another
They're all gone. It's just you and me.
Oh, are they gone? Okay, good. Okay,
Mhm.
then I'll make sure I email that information. I
What-
think that was wonderful.
It was very wonderful. It was a blessing. It was beautiful.
Yeah, that was awesome.
Very
Okay, I
awesome.
don't know how to stop this live chat, this YouTube, so I need to log out and we can talk on the phone.
Yes, ma'am. Okay.